thank you all for being here again for the 14th Annual Hall of Fame Awards. This is what I refer to as my Yom Kippur. Yom Kippur is a day that's set aside for atonement and reflection. I think if we live our lives properly, we should have nothing to atone for, so we can do away with that. I do think stopping once a year and formally thinking and reflecting about what we do and how we do it is an important day. And I like the idea of doing away with this fasting nonsense. So this is my day of reflection. Those of you who had heard John Haslam's presentation earlier today, and again, who may have heard it previous years, we spoke about impact. And some people who have the fortune to work in rare diseases have huge impact on people's lives, but not necessarily a large number of people. Other people in our industry work in therapeutic areas where the impact per person isn't necessarily as dramatic, but so many more patients. And as marketers, we understand impact is impact per hit times number of hits, total impact. If you look around this room and you think about all of the therapeutic areas that we are involved in, and you think about the incidence and prevalence of the disease states that we are involved in, the vast majority of people in this country are affected directly or maybe one step removed by the people that are working in this room. I think that's an awesome responsibility. It's one that I take very, very personally, and I think we all do, and take that responsibly. And that's why I do feel compelled to come back here every year in this capacity. The people who are inducted are people, and their criteria for being inducted are private nominations. So check the Chronicle Healthcare Marketing for the nomination process in the spring. And the criteria are to make a lasting impact on others, to serve as a source of inspiration, and to demonstrate extraordinary dedication and commitment to the humane principles inherent into our profession. And it's on that last bullet point that I give rise to the first award, which is the Phil Diamond Humanitarian Award. Phil Diamond was an individual some of us had the privilege of knowing. He passed away a couple of years ago. Phil was very successful in this industry, but he never lost sight of the patient. And he himself was constantly going to the hospitals as an ex-cardiac patient, meeting with cardiac patients, giving them, telling them what to expect, and talking to them as if only somebody who had been there could do. He also was responsible for raising many hundreds of thousands of dollars for various charities, especially for sick and dying children. And it's in his honor that the Healthcare Marketing Hall of Fame has created this award. And the recipient of the award this year is Dr. Gary Sibbald from the University of Toronto. Dr. Sibbald, if there's anybody who has earned the right to be conceited, it could be him, and yet he's not. He is not only a local key opinion leader and a national key opinion leader, he's an international key opinion leader. The only person I know that's had a private audience with Princess Anne. An amazing individual, and when he speaks, all the dermatologists in the room listen. He is one of the world's leading authorities in the management of wound care, and also spends a lot of time in education, medical education. And presenting to Dr. Sibbald today is Peggy Ahern. We all know Peggy from her previous years as president of the Medicines Group, but also an international leader in wound care and wound care management. So we'll call upon Peggy Ahern.
So that was quite an introduction that you already got, Gary, but I'm thrilled and very honored to be here this afternoon to introduce Gary Sibbald. And we were debating, when I first wrote this, I said we'd known each other 20 years. He corrected me and he said it's 30. I said, well, I don't want people to think we're old, but we've known each other for a long time. And during that time, I've known Gary as not only a brilliant clinician, he has two specialties, but also a true visionary. Gary's vision has led him to always do better, there's a Japanese word, kaizen, which is the relentless pursuit of improvement and excellence. And to me, that really sums up what Gary is all about. Here in Canada, Gary has been involved in setting up a number of professional organizations, but he has also taken that work to international companies. He's taken education and better solutions for better patient care and outcomes. Gary took a team, a Canadian team, to Guyana a few years ago, with Dr. Brian Ostro. They they went to a country that had great healthcare needs and very limited resources. They set up a center of excellence for patients, for diabetic patients, and a series of clinics across the country, which have subsequently become part of the Ministry of Health's program. The work that they did, which was, kind of against all odds, was truly amazing, and it has been widely published. And the data shows that through Gary and his team's work, they actually not eliminated, but decreased the number of lower limb amputations by 70%, which is a huge, huge difference. Gary has traveled around the world. He's been to over 30 countries, offering education to over 400 opinion leaders, and many of them have subsequently gone on to set up their own clinics. Here in Canada, he met a fellow by the name of Todd Nicholson. Todd Nicholson, in 2006, was the captain of the Canadian Paralympics sledge hockey team, and they were preparing to compete in Turin. Todd developed a very severe pressure ulcer, and it was very doubtful that he was going to be able to compete. Gary got involved and developed a plan of care for Todd that included IV antibiotics and various wound care programs and devices. And the good news is that team went on to win the gold medal. Gary has always told me over the years that his goal is being to make a difference. He said more than once to me that I want to improve things. I want to improve patient care. I want that to be my legacy. And I think through all of the work that he's done, through what I've told you and what Lauren told you, Gary, you've really achieved that objective. So it's my pleasure to introduce my colleague and my friend for 30 years, Gary Sibbald. Dr. Gary Sibbald.
And what Peggy didn't tell you was that she was actually the person that got me into wound care in 1985, Peggy. So that's a long time. And Peggy's also helped me on another journey when an organization I founded with Kathy Harley, Canadian Association of Wound Care, got into trouble. And I know both Peggy and Miriam Batros, who's here, really helped us in a great way to make that organization still live. I would like to thank my mother, Marion Sheard, who is sitting here with Her Excellency the Mayor, and there's only one mayor when it comes to Mississauga. And certainly Gail Wilding and Marion Sheard, and of course the 6 Dr. Sibbalds in my family. But it's also been a very good industry liaison. And Mary McLean, Dave McNeil, Carol Robinson, Tarek Elam, I really do thank you for all your support and continuing support, even beyond the Canadian market, so that we could actually go and make a difference in West Asia. And also here is James Elliott. And James is a person with diabetes, but has really led our declarations for Africa. So if you go to a website, T1 International, and Insulin for All, or Saving Limbs, Saving Lives, and this is really our current mission. I would like to thank Madam Mayor and Bill Davis for getting me appointments with health ministers, which after this speech today at 3 o'clock, Bob Bell has lined me up with 22 people in the Ministry of Health. So if I'm afraid now, I'm even more frightened for this afternoon. But I think probably the biggest lessons come from the students we teach. And Elia, who works for one of the companies in West Asia, said wound care is a humanitarian mission. And Nefford, who is the chief surgeon, orthopedic surgeon at Moy teaching hospital in Kenya said, "See me as a seed, not as a need." And I think all of those things exemplify what we can do with education and what we can do to make the world a better place. So thank you very much.